All right, welcome everyone. I want to thank you for joining us this afternoon or this morning, I guess, depending on where you're joining us from across the country or internationally, if we have anyone joining us from outside of the United States. I want to welcome you to today's National Network of Libraries of Medicine webinar. My name is Derek Johnson, and I'm the Health Professionals Outreach Specialist with the Greater Midwest region of the National Network of Libraries of Medicine, and I'll be serving as your host for today's session. For those of you who might not be familiar with the Greater Midwest region, we are located at the University of Iowa, hence our kernel of corn in our logo there as part of our Kernel of Knowledge series. So just a few housekeeping items to note. You are all automatically muted on entry, so please use the chat panel to ask questions or make any comments. You may need to exit the full screen mode to access the chat box. To do this, if you scroll up on the top of the Zoom interface, you'll see a View Options drop-down menu, and you can exit full screen mode. And then on the bottom of the Zoom interface, there is a chat icon that you can select to type into. Just make sure that if you're using the chat, that you use the drop-down menu to select all panelists and attendees so that we can all see your questions and comments. This session is being recorded, and we will post this on the National Network of Libraries of Medicine's YouTube page for future viewing within the next week or so. I will also email a link out to that recording to anyone who registered for today's webinar. This session is being live captioned, and I'm going to place a link into the chat box now that will take you to that live captioning stream if you are interested in live captioning. Finally, there will be 1 credit hour of continuing education offered at the end of today's webinar for the Medical Library Association. You'll need to complete the evaluation survey, and I'll post that in the chat box at the very end of the session so that you can fill that out and receive your certificate. So with that, I want to turn things over to our presenter today. So Caitlin, we're all set.
Thank you, Derek, and welcome everyone. Thank you for joining me today. We are going to be talking about helping patrons navigate Dr. Google as what it's become to be termed, the new term. This is basing off of the first phase of an ongoing project, Health Online, Finding Information You Can Trust. You may have heard about this program, which I'm going to be diving into a little deeper in our discussion today. A little background about myself. I am a health communications specialist at Wisconsin Health Literacy. I have a background in marketing communications and working in healthcare and nonprofits for about 7 years now. And I've really focused in on health literacy back in 2014, and when I attended a health literacy conference out in California, and I've really become dedicated since that time to helping others understand health information and learn about the opportunities to have a healthy life based off of just coming from my background and working in marketing, and put a lot of materials online and printed materials to when I found out at that time was at a very high reading level compared to what it should be at. A little bit of background about Wisconsin Health Literacy. We are a nonprofit organization. Our organization is based in Madison, Wisconsin. We are a division of Wisconsin Literacy, Inc., you may be familiar with. There are 4 divisions of our organization within member agencies, serving over 75 member agencies throughout the state of Wisconsin, and community literacy, adult literacy, family literacy initiatives, advocacy, working with state legislators to advocate for literacy, health literacy, a workforce, and then our last division would be focusing on health literacy, in which you can see here in the photographs displayed a lot of the work that we do. We conduct many community-based workshops throughout the state, and that is mostly my position. I'm a grant-funded position where I go to various communities. I've traveled all throughout the state on doing different programs on safe prescription medication talks, talks on flus, talks on dementia, And you'll see the one in the middle there working on the iPads. That's our Health Online program that I'm going to talk about today. We also host a Health Literacy Summit every other year. Our next one will be in Madison, Wisconsin in April of 2021. And it just brings together many different professionals from healthcare, academia, literacy professionals, librarians, all different levels that are just enthusiasts for literacy and health communications. And we have a really great collaboration and turnout at that event. And we also have a national collaborations with literacy organizations and health organizations and presentations. As you can see on the bottom right there is our executive director of Wisconsin Literacy, Michelle Erickson, presenting at the roundtable of the National Academies of Science, Engineering, and Medicine. So those are just a few of the things that our organization does. The biggest thing is just really advocating for literacy and health communications. On our agenda today, so we're going to be diving into digital health literacy, taking a little background, taking a step back to understanding health literacy and why we're doing the project we're doing, talking about our community-based Health Online workshop and communication techniques that you can incorporate at your libraries or your organizations to run a program like this. Also hear from the feedback we're getting on the program, as well as the process we went through with the National Networks of Libraries in Medicine, and maybe some opportunities that you can utilize their resources as well. So before we dive into the communication workshop itself, it's important to understand the background of digital health literacy and what got us to focusing on the project we are talking about today. Looking at literacy, many of you are probably very familiar, what is literacy? It's using those printed and written information to function in society, to achieve one's goals, and to develop one's knowledge and potential. When we break it down, as there are many different forms of literacy and focusing just on health literacy, we're wanting to use that wide range of skills that can improve the ability of people to act on their information in order to live a healthier life. So it's more than just a series of tasks related to health. It's reading, it's writing, it's listening, speaking, working with numbers, critical analysis, and the communication interactions that they have within the office, with health insurance workers, and at the library, trying to come up with navigating health information, whether it be in books or online. This means that having health literacy, a person is able to understand instructions on prescription bottles, looking at appointment slips and remembering, okay, when's my next appointment, looking at medical brochures, provider instructions, and consent forms, filling those out, being able to, a lot of the brochures are online these days, whether it be printed flyers that are shared via website links, or communications via the health portal from the provider instructions and reading test results. Trying to just navigate the complex healthcare systems itself, from health insurance, what benefits are provided for one's care, to understanding those explanation of benefits, deductibles, copays. So it's really the whole scope of overall healthcare. Keeping that in mind, we like to think that looking at health literacy and trying to get a scope, this information is back from the NALL study, which is the National Assessment of Adult Literacy. And this was back in 2003. So we're really trying to get more and more statistics to get up-to-date information. But back in 2003, we can look at to see those below basic or at the basic literacy levels make up that 36% circled here. So that's 1 in 3 are struggling in the US, adults are struggling with low health literacy. Which brings us to talking about information that I mentioned before, about how more and more information is becoming available online. When we look at that health communications on the health portals, when we talk about looking at insurance or even signing up for insurance, a lot of it is having to be done on the online health.gov marketplace, or trying to just get recommendations for a doctor or researching a disease. All this information is being more and more recommended to go online and look up health information, and more people are starting to use the internet themselves. Looking at a research done by the Pew Research in 2013, this was published in January of 2013, 81% of US adults were using the internet just to look up any information, and 59% of those US adults were using to look up health information online. And this was a nationwide survey of 3,014 adults in the US. Now, taking that into consideration, what they weren't taking into consideration was the digital divide and those that are struggling with low health literacy. Those vulnerable populations, whether it be those with different background, refugee, immigrants, seniors, those that haven't used computers, they're less likely to use online resources because they have difficulty finding reliable health information online. They don't know where to start, let alone difficulty navigating and reading information online. And then there's that whole issue of accessibility concerns. And this just not for the rural areas when you don't have low Wi-Fi. I was in very urban population yesterday in Milwaukee at a literacy services, and their Wi-Fi at the literacy center itself was very spotty, and our program was cut in and out from a low Wi-Fi connection. So it's just not those rural populations that have the accessibility concerns. And then when we look at the statistics itself, this is back from the 2003 Null study, 15% of adults below basic health literacy used internet to find health information. So back again, when we were looking at the previous slide, that 81% of US adults use the internet, 59% of the adults look up health information. When we have that digital divide, only 15% were those with low health literacy because of the difficulty that I mentioned above. This is a 2003 study, and 31% were looking up information online at that basic health literacy level, 49% with intermediate health literacy level, and 62% at the proficient health literacy level. So you can just really see the differences in statistics there on, there's that divide and gap on who's accessing the internet. I just wanted to give you a visual of some usability testing that was done. And this is from healthonline.gov. They sourced, it's called eye tracking. You might be familiar with. Many organizations that have their own website can use this to look at one's eye tracking to see what they pick up online, what their eyes are going to, and how user-friendly the website is. And when they compared that from someone with more of a proficient literacy level to one with a lower literacy level, they got quite substantial different eye tracking data back. As you can see, the one on the left is one with a higher proficiency than compared to the one on the right. The one with the more dots is the lower literacy level. The reason being is the ones with lower literacy are having to do multiple rereads on the page. They're not sure how to navigate the page, where to start, where to read. Their eyes might be attracted to a certain centerpiece of the web page and not go back to reread the beginning. So there's a lot more time spent for those with lower literacy on a web page than those with a higher literacy level. Thus, ultimately, being very intimidating to want to use a web page and go on it when it's going to take them probably twice as long to navigate that web page than those with a higher literacy level. So this really brought us, after hearing about all these statistics and studies, we came together with the National Networks of Library Medicine, proposing our idea for their grant-funded program through the Greater Midwest region to form a partnership on conducting workshops on navigating health online information to form a health online information you can trust. So I'd just like you to think about these things. What do you do when you want to find ways to get healthy, or your child has a rash or has come down with a sudden illness, or maybe your friend is diagnosed with a rare disease or illness you want to do more research on. Maybe your mother starts signs of dementia and you need to find a caregiver, or you need to find the best health insurance out there. What are some of the things that you do to navigate this information and to find it? And we ask that question a lot in our workshops, and we still, we get a lot of people, word of mouth is very, very important. But there's a lot of people that are also, I go online, or as we like to call it, Dr. Google. Searching Dr. Google to get their answers. So this has really become the new norm. Now we're going to dive into our community-based workshop, and I'm going to give you an overview of what we do for this workshop. We are conducting 32 community-based workshops, primarily at libraries throughout the state of Wisconsin. These are 90-minute workshop, on-site workshops for patrons to come, and as you can see in the photo there, this is at Deer Park Library in Wisconsin. And they're getting the iPads to use to have that practice themselves using the technology, doing searches, reading web pages, and going through the process together to navigate health information. This is hands-on learning. They don't get to take the iPads home, but we do have handouts for them to take home that provides many of the content of our online program. So I want to show you what our online program is about. This program was created working with a medical librarian through the UW, working with providers and our medical staff that we work with at Wisconsin Health Literacy, as well as the National Networks of Library Medicine. I'm working with Derek himself to review the webpage and come up with a curriculum that we could be used for all patrons throughout the state.
Hey, Caitlin?
Yes.
Are we supposed to be seeing something other than the community-based workshops slide?
Yes.
Okay, so that's what we see right now.
Okay, let me get out of, can you now see? Can you now see the website?
Now we can see the website, yep.
Wonderful. So here's the program. Everything is online that we've done. So myself, I'm usually the one up there facilitating the workshop, and this is what my screen will display, as well as the patrons will have this on their iPad, navigating through this simultaneously. The overall gist of the program, we're searching for health information that can be trusted, and then we're diving into how to read a web page. We're looking at scannability of a web page and those quick tips, as well as looking at the search results. We're looking at how to tell if information you found is from a good source, catching up on those red flags, pointing out what things are credible and what not, finding websites in other languages, the differences between using a computer and a mobile device, where are those reliable places to use the internet. So this is a point where we really emphasize on using your community resources, the libraries, and then using other online resources for your health. So I'm just going to do a quick overview of this program. In addition to the community-based workshops, we also do a Train the Trainer program where we go into this a lot more in depth and talk about each of these steps. But I just want to give you an overview of what the website is. So in the beginning, we take probably about a good 10 minutes to just talk about some common web terms and logistics on using an iPad. You have to remember, we're trying to reach those vulnerable populations. So many of those patrons coming into the workshop have not used an iPad before. So we're taking the time to instruct them on how to scroll, how to zoom in, what these some of these standard definitions are that we use a lot throughout our communications in the workshop. So we go over each of these, as well as, you know, I have a laptop there too, and showing them how to navigate using a computer as well. We talk about how using online resources can be helpful. So it's really important to point out why they should be using these online resources. Finding that information quickly. Many today have smartphones, but not everyone does. Still, there's many places that you can access computers if you don't have one at home. And then what can you access when you are using the internet? What should they be doing on there? They need that help. They need that instruction on what to look for. And then we really get into searching for health information, and this is where we talk about the different search tools, explaining what a search engine is, and then some of the neat features on privacy and utilizing some privacy tools, with DuckDuckGo being the private search engine, and the difference between that and using a private browser, those capabilities, because privacy is very important for people, especially when it comes to health information. Whether having that insecurity of looking up, they were just diagnosed with breast cancer and they don't want their family to know they're looking this information up online, or whether they're using, you know, a public computer, even being at a library, and you know that their searches are private when the next user logs in, but giving them the options that it can still be even more, you know, private using these browsers, because they don't want their social security number, payment information if they're using it to pay medical bills or fill out health forms. Privacy has been a big concern, and this is something that they really like to learn about. And then to make their searching the best it can be, we go into tips for doing a search and what are some efficient things to do as far as listing multiple symptoms, using a full disease name. These tips are very important to get the most narrowed search when doing, you know, performing a Google or a Bing search, that you don't get just all these things from, if you were just to list, you know, I have a fever. Well, is that saying that it's because you have an infection, or is it because, you know, you have cancer? You know, from one extreme to the next. So the more symptoms that you can put in there, the more narrowed results you're going to get. So these are the things we talk about in importance for doing a narrowed search. And then we actually have the participants do a search themselves and see some of the differences when, for example, of using a full disease name, putting in upper respiratory infection, comparing doing a Google search of cold, and then comparing doing a Google search of URI. This makes a big difference of what your search results are and what you're going to get. When we have those do upper respiratory infections, they get a lot more in-depth information compared to when you do URI. I'll just do that quickly here on my Google for you so you can see. You know, how many times do doctors talk about things shorthand being URI, and I get the University of Rhode Island when really my doctor was talking about upper respiratory infection. So that patient, if they heard URI or saw it on their paperwork, they might not know what other ways can I search this. So that's what we talk about and performing a good search. Then we really get into some websites that we recommend them to go to if they don't, you want to always use the Google or Bing search, the search engines. We really focus on using Medline Plus and how efficient that website is. We give them a few minutes to navigate through the website and showing just how easy it is to navigate through this, and the opportunities to explore the different health topics and what they need. So that's a big focus of the program. And then we go into many of the other, a brief overview of the other websites as well. And then we are particular to doing workshops in Wisconsin, so there are some specific websites that are important. BadgerLink is a not medical, but a health or library online that is just for Wisconsin residents. And so there's some really great medical information for Wisconsin residents, such as like on Medicare and Medicaid, whether they might need just housing information or completing a GED. BadgerLink goes beyond just that health contents and provides specific information for people looking for resources in Wisconsin. Those that might need Medicaid, Medicare assistance in Wisconsin, we give that resource. Again, we're working with the vulnerable populations, so this is going to be a good resource for them to know what opportunities are available for them for Medicaid services. And then there's, as I found throughout doing many of the workshops at the libraries, I was hearing a lot of patrons were coming in asking for legal advice on medical questions. So we recommended a website for patient advocacy and legal resources here through the patientpartnerships.org website. We then talk about the differences in levels on websites. So this first one is here for basic consumer health information. And you just briefly touch on how there can be some more advanced resources online at these websites. And just to pay attention when you're on these websites, if the terminology seems more technical, more medical, that it could be because it's for a different user and not for the everyday patient. It might be for someone in the health profession or a doctor or someone doing the research journal. So we just wanted to show those differences. And then there's always the question about Wikipedia. So we make sure to point out that it can be an okay source, but to always follow up using one of the recommended sources, resources, websites listed above. We talk about websites to search for recommendations. So this really gets into your consumer review websites. People are trying new services and wanting to know what doctors to go to, or back to that question about needing a caregiver for maybe your mother that's starting signs of dementia. There are many directories and resources out there for websites that can help your search and navigating, and these are just a couple websites that we talk about here. Then getting into how to read a web page. Some participants might think this is pretty straightforward. You open up a website and there's words there, start reading it. But go back to that eye tracking section with the low literacy learners and those that have a hard time of where do I begin. So this is a good time to pick up, okay, take a step back. Don't just assume that everyone knows how to read a web page and even how to read. So what are some things that they can quickly pick up on? Start with those bigger, bolder words. That's going to be your main content of the web page. So if I look at this section right here, I'm going to be talking about how to read a web page. Okay, so I know what that's going to be my main content. I better be able to learn how to read a web page. And then getting into reading left to right, and then using those toolbars in the top menu bars. Again, those low literacy learners might not know what they're used for. Those are ways to help them navigate the web page and make their online experience easier to use, maybe more efficient and quicker to find what they're looking for. And then to read the content before clicking on a hyperlink. This is very, very important, especially when we talk about spam and pop-ups popping up. This is stuff where they might not know, and it just says, click here. Well, what am I clicking here on? So show them how to find out if that hyperlink is something that they can rely on, and if it's from the website that they know about. And then this diagram here is a good visual for them to learn, and talking about ads and the main content and supplementary content. We go over it because ads are sometimes always just thought about being bad. If there's advertisements on a website, it must be a bad website, it's just garbage. Well, no, there are some websites that need advertisements to survive, and that's how they get their income. So we talk about that and the importance of understanding the content in the ad and if it's far-fetched. So we really get into reading the web page and what we're looking for. Then we talk about scanning those search results. And not just picking up on the top 2 results, because why are those results at the top of the page? Are they really the best information, or is it just on the top because that's how Google's tracking it, because it's the most searched website? Because was it in an ad, or is it because it's really good information? So those are the things we make them question what they're clicking on and what they're looking at. So from that, we go into actually looking at the credibility of a web page. This gets the users comparing websites and really digging deep into the website to find the About Us section, reading the content for unbiased research, checking at the bottom of the web page for dates, sponsors, crediting. We're really checking for that proof that it's a trusted source. We talk about domain differences and how important those differences are, from being a .com, most likely owned by a commercial business. But this doesn't mean that it's a bad website. It's just what's on that website, what's on that web page. Again, .com is probably going to have a lot of advertisements. So it's looking at those advertisements and are they related to health, or are they related to win a car by signing up today, or lose weight in 10 minutes by taking this miracle pill. Those are the things we're looking at when we get to those .com websites. To then understanding why we go to a .gov website, .org, and .edu, what our content is mostly going to be sourced from, and how we're going to be reading and understanding that content, because it's coming more from maybe a researched article from a school.edu, or it's going to have more facts and figures and a global health approach looking at a government website. So those are some of the differences we look at. Then we get into comparing the health.com versus Medline Plus. So we go back and forth between the two sites and compare, looking at the About Us section, the content itself. Again, I reiterate on those credible things to learn for. Repetition is key when we're looking at online information. There's a lot to comprehend from this workshop and a lot to take in. So repetition on these steps is very important. As part of the handout, we have a checklist on the back of the handout, and it has evaluating sources. So there's a list of questions that we like to go through. This is something that you don't have to do every time you go on a website. That itself can seem intimidating if you say, I have to check off all these questions every time I go on a website, and that's going to take way too long. But it's just a good practice to go over in the workshop if you can go through these questions. And then so we do evaluate a website using the checklist, looking at familydoctor.org. So we go over who runs the website, who's providing the information, are there ads, and we really dig into it. And then, we look at the year at the bottom. So we're going into examples of websites to show them these things that they need to look for. After we get into the evaluations, we kind of just do a review of websites in multiple languages. This is becoming more and more popular. Medline Plus it's very awesome that they provide immediate translation from English to Spanish in their materials. So there's this button right here that goes from English to Spanish. Makes it very user-friendly. And then we talk about how they have over 48 different languages and materials translated as well. Again, we're working with vulnerable populations, and we've now started a phase 2 of this program where we're going to really target vulnerable populations and working with refugee immigrant populations and trying to connect them with libraries. So having this resource as well is going to be a huge benefit and important topic in the program. The differences between using a computer or mobile device is discussed, as it's important they should know how much less room is on these mobile devices, so there might be less text than when they're looking online on a desktop. And if they want to sit down and do some thorough research, maybe it's probably better and recommended to go on a computer versus using their phone or a tablet, where they're going to do a lot of scrolling. It's going to take longer. It might not have all the content versus when they're doing it on a computer device. Again, those local places to use the internet. Not everyone's aware that they have maybe the data on their phone and where they can use their services, the Wi-Fi, you know, going to a local cafe and their surroundings. So when I go to workshops, you know, I talk about the cafes in their area that provide free Wi-Fi and how important it is to have that security on that Wi-Fi of, you know, entering a password and not just hooking up to any Wi-Fi. But as well as those other places that provide computers and Wi-Fi as well, at the library, at hospitals, the health departments, community centers, and at schools. So there's always a way to find something if they don't have that Wi-Fi or internet connection at home. And then we wrap up the session with other online resources that are available with emerging technology. There's a lot that can be done with the voice recognition with Siri and Alexa, asking them, you know, what is a deductible, what is a copay on those, and getting that audio response back. To then utilizing the health portals. Those are being pushed more and more at the clinics and hospitals for that two-way communication between the doctors, nurses, and patients, as well as getting, it's like an online encyclopedia that you know is coming from a trusted source. They have good health topics on the health portals themselves. So there's a lot that they can do there. We briefly talk about, you know, wearables and tracking, and then some apps. A lot of people are wanting to go, you know, mobile friendly, and what are some recommended apps that they could use on their phone, as well as some and the National Libraries of Medicine mobile resources that are user friendly. And then for those that prefer maybe to just have some magazines or e-newsletters, we do mention that websites do have subscriptions for these, you know, newsletters and emails, and we kind of put a little plug-in for NIH Medline Plus information, but there are many of them out there. Some are free and some not. And then that's the end of the online program. So this is something that is accessible. We give the website link to other participants, and for you yourself, this is something that can be accessed at any time. You don't just have to be in the program workshop itself. And so that's really, really a neat tool. All right, let's get back into the presentation here. So again, they have that online program, and then there's 2 handouts that I can provide after the webinar today that you can see that they have pretty much everything. Yep.
Yeah, we're still on the website.
The sharing, thank you.
Yeah, I think that should probably work. There we go.
Working? So those resources we'll be sharing with Derek after to send to you that are pretty much everything on the online program, but mostly, you know, a lot of the important tips to take away, and then some room for notes and whatnot, and then that checklist I talked about. So again, these are, as far as, you know, through the National Libraries of Medicine, again, a recap of the resources that we highlight in the program. We talk about the website, we talk about mobile apps and mobile friendly with the drug information portal. We talk about the email and print material options to capture all of that, hitting many different ways to get health information. So what we're learning from the program itself, we did a survey from Adult Literacy Center, and they want to find health information on symptoms, resources to stay healthy, and it's really important for them also from the literacy centers to get it in other languages. I wanted to point out this picture that I'm showing here was actually from a workshop yesterday at the Literacy Services in Milwaukee. It was just such a unique opportunity. We had adult basic learners in there tutoring English language learners in the class from many different languages, many different backgrounds. So it was a really unique opportunity to work with those populations and have them capture the materials in their own different way. They also want help scanning websites for relevancy. So that's really important why we focus on reading a web page, because this is what we're hearing from those adult literacy learners and the information they're wanting to capture. We also did a focus group in 2018 at the University of Wisconsin Family Medicine practice. They surveyed about 20 individuals. Most of them were an older population. There were a few under the age of 30, but most were above the age of 50. And just asking them, what they were looking for and what they preferred in finding health information. And just from their immediate in-person response, the younger population preferred the MyChart, the health portal, or searching out symptoms online, where the older population preferred urgent care or primary care, going to the doctor and asking those questions. So you can kind of see a generational digital divide that we talked about. So it's important that we get those, the older, the seniors and the older generation comfortable with using these online materials and resources. And then when we asked about most websites visited, a lot referred to Mayo Clinic, WebMD, or they just plain out did a Google search. From the statistics that we're gathering from our program, we are doing a pre and post survey on the community-based workshops. And we're asking them, what websites is a good starting point to find reliable health information, if they can access reliable health information online at the library. We're wanting to know if they know how to scan search results. So based off this pre and post survey, we're finding an improved understanding for our learners, which is great to see. Our point that we're trying to reach our threshold is at a 20% learning increase, and we've succeeded that. And these are preliminary survey results, but they've indicated there's been an increase in 40% of identifying the reliable website, such as Medline Plus. Increase in identifying a local library as a reliable resource to access health information. So just knowing that, people didn't know libraries were an okay place to go to get that health information, and coming out with understanding they can go there. Then there's an increase in almost 33% in understanding the criteria for scanning search results. So understanding that don't just look at those 2 top search results and expand on that, scroll down and see what else will come up on your Google search. There's been a 41% increase in recognizing one way to tell if a website was credible. So looking at that About Us section, or confirming the date is up to date, reading if it's biased or unbiased information. So those are the things they're picking up from the program. And then they're seeing almost a 40% increase in confidence finding good health information online. So their confidence after the program has increased almost 40%. And then just to give you a little overview about our funding process and how we got to where we're at. We applied for a health information outreach grant up to $50,000 for 1 year. That was back in 2018. Through 2019, we are finishing up here in just a couple weeks, providing letters of support. We really have had great support throughout the whole process itself, with Derek and a project coach reviewing the submission, having quarterly meetings. So just know if you're interested in something like this, you're not in it alone, and there's a lot of support throughout the way. NNLM is very involved. Again, just some more ways that we've worked together. Having the project coach before, during, and after the grant itself. There's been many resources that NLM has provided with webinars, articles, and working with professionals. Blogging, promoting, and sharing our stories. As you can see to the right, they're doing announcements on the workshop itself. And then there's been a lot of opportunities to expand as myself, as a health professional. For example, their consumer health information specialization certification that they have is an opportunity they open up for librarians and non-librarians. So that's really, really nice. So you might be wondering, okay, what can you do to get involved in this program? The first step is just to become familiar with our online program. That link on the website I showed you before, this is something that you can access at any time. Another good step would be to bookmark Medline Plus on your library computers or the computers at your organization. This is just a great step to let the users know, okay, this is a reliable resource that we recommend to go to find health information. Start looking for websites that are reliable in your practice. Do you know what they are? Can be a good way to just, test yourself and looking for that criteria and credibility in the websites that you use day to day. And then additionally, another important step is to host a workshop. I would say if you're in the Wisconsin area, I would be more than happy to connect with you and help you host a workshop as well and facilitate that. But in January of 2020, we are planning to do an online webinar, Train the Trainer series, if you're interested, through the All of Us program. So stay tuned for information on that. That will be at the national level if you're interested in being trained on this to facilitate your own workshop. We'll have a more in-depth review of the program in January. And then in addition to, the Health Online resources and doing a workshop such as this, there are many other ways that you can bring health topics into your library. Just for an example, NNLM, the Greater Midwest region, does many call for proposals and bringing different grants on, mobility for all, bringing yoga into the library, developing a health corner in public libraries. So there's a lot of different opportunities if you're wanting to expand from the Health Online program and just bringing different health topics into libraries in your organization. So I welcome this time to open up the chat room and maybe share some best practices that you have or questions.
Great, thanks so much, Caitlin. And yes, please, I see a couple questions have been coming in the chat. If you have them, please type them out and just make sure you're checking all panelists and attendees so we can all see what your questions are. So one of the first questions, Caitlin, and you might not be able to speak directly to this in the geographic location, but the question is, as a librarian working with immigrants in Indianapolis, there are always questions on finding free clinics or breast examinations. Do you have any tips on where I can find that type of information?
The best I would say for Wisconsin, some of the best resources would be that Department of Health Services. So I would definitely look at your Department of Health Services website for the state. They provide a lot of great free resources as far as Medicaid programs, Medicare. And then also, we don't touch a lot on social media, but social media is good for the one following your area clinics or hospitals. They usually tend to share upcoming events like that, or even just going on the local hospital clinic web pages to find their upcoming events, I think is the best way to find those free clinics.
Yeah, that's great. And I might even say, trying to partner with the Department of Health Services or county public health departments, letting them know that people are asking those questions. They might be able to provide you links or even, let you know ahead of time when things like that might be taking place.
Yes, that's a great addition. Thank you.
Another question is, in the past, WebMD hasn't necessarily been seen as a reliable source of information. Can you speak on that?
You bet. Yeah, I think it has kind of gotten that reputation just because it was, it's been in the website around for a long time and it's been used for many years compared to some of the newer programs, but I think it's sometimes that reputation just because it's a .com, so it has that commercial website domain on it. It's again looking at the articles and referencing that the articles are being sourced from a health professional, and that's always just a good thing to back up. Yes, it's at this website, but who is the article being written by, reviewed by? And then again, it's more just user preference, and a lot of people are wanting to get away from advertisements and pop-ups, and unfortunately with those commercial websites, that's how they rely on their website living, surviving, is having those advertisements on the web page. So it provides some very good information. Doctors have used it. It has been recommended in our program, but it's just more of a user preference if you're going to be annoyed by advertisements or not. Where, Medline Plus, they don't have advertisements on their website.
Great, thanks. And then there's a question about the Train the Trainer and wanting more information. How do you have any idea of how more information will be released about that, or how people can find more information about that?
And maybe Derek, you can help me out a little on this. I think we hope to start marketing in December for it, and I would be following the All of Us program and the marketing they do. I know for Wisconsin Health Literacy, we'll be putting it, on our Facebook as well, and maybe we can start in the chat. I don't know if we can take a list or just send out the information to all the attendees when it gets closer of the webinar.
Yeah, I think at this stage, because it's really in the preliminary planning piece, we aren't quite sure when it's all going to take place. I will put my email address in the chat box, and if you are interested in learning more information when that becomes available, we'll email me and we'll save your email addresses and make sure that you get notified. So I'm going to put that in there right now.
I did want to make note too, if you are interested in the Train the Trainer series in Wisconsin, we are still in the second phase of the program through April of 2020, and we have room for a couple more Train the Trainer workshops. So if that's something of interest to you, again, in the Wisconsin area, connect with me. I will share my contact information there on the screen. So feel free to reach out to me if you would like to set something up.
All right, and another question, will you share a copy of the packet you give the workshop attendees with us?
Yes, I can send, I'll send you, Derek, the PDFs of the PowerPoint here and the handouts to share with participants.
Okay, so I will look for an email from me probably within a week once we get the video, this recording uploaded, and we'll include a PDF of the slides and that handout as well. And a question, is the Train the Trainer in person or online? I believe it will be online.
Yes, the one in January for the potential is online. The one in Wisconsin, if you're looking, obviously is in person. I will go to you.
All right, if you have questions, we still have a few more minutes, so feel free to type those in and send them now. I'm going to, so Caitlin generously mentioned a couple times the funding that this program received through the National Network of Libraries of Medicine and specifically the Greater Midwest region. I just wanted to let everyone know on the call, if you happen to be within one of the states that makes up the Greater Midwest region, we just released our call for proposals. The application actually went live today. And so if you are interested, we are hosting an informational webinar next week on the 23rd. And if you're interested in attending and learning more about the application process, I will put a link to that in the chat box now, as well as the states. So if you are in one of those 10 states, you would be eligible for funding. If you are not in one of those 10 states, your region will also make funding available, but it will come at a later date. So just be sure to check with your regional medical library for your specific state to know when their call for proposals will come available. All right, are there any other final questions? I'm not seeing any, but we do have 5 minutes, so if you do have one that pops into your head, we still have a little bit of time. I'm also going to put a link now into the evaluation. if you click that link and fill out the evaluation, just select yes to the last question if you want to receive Medical Library Association continuing education. That will provide you the code that you need for that, and you can start filling that. Caitlin, I'm curious, I guess I do have a question as we have a little bit of time. Well, here, another one came in. It says, covers a lot, both the technical and the analytical. Do you find that your participants can absorb both the technical and the analytical in a single setting?
That's a great question. I kind of customize the workshop to each particular setting and everyone's, learning process and how comfortable they are with the technology itself. So there's sometimes, where we don't get to maybe some of the material at the end and talk about it, but I, stick around for questions. I try to be understanding of everyone's 90 minutes for the program. Sometimes I do see if we can make it a 2-hour session. That's not always the case. More people like to stick to the hour and a half. So it is a lot, but we go at the learner's pace. And if there's some stuff that we need to skip over, there's some stuff you need to skip over. And if there's some stuff that you get to and get more questions, that's great. So I just say make it customized to what your learner level is at.
Okay. Great question. Are there certifications for public librarians without background in the medical field?
Are there is that for a question for myself or?
Well, I think there is a consumer health information specialization certificate that Caitlin mentioned, which is probably what you might be thinking of with that question. I'm not sure if there's other certifications that are out there.
I'm not familiar with any specific for medical librarians or and that content's related to health information online. So the one I'm most aware of is yours, is that you just spoke on.
Okay, she said that's the question. Thanks. Okay, so consumer health information specialization. If you have more questions, feel free to email me and I can provide you some more information about what that looks like. And as we're kind of winding down, I'm just kind of curious, getting back to sort of what the last question was about like kind of the technical and the analytical piece. And do you find that participants, there's sort of an aha moment with either just like learning kind of how to use and search websites versus the health information piece? Does it really vary based on your audience in terms of where people are at, or?
It does. I've had participants come in, that have never touched a computer, iPad, and then I've had a senior walk in that has more knowledge of apps and more apps on his phone than I knew was possible, but they're using them. So it really has that different aha moment. It's really interesting to see everyone's aha moments, and you do see them when they're, oh, that's what Google does, or even understanding what a browser is, from that really technical, I didn't know that's what a browser is, to there's a private browser, there's a way that I can keep my information private and not track. So those are some really more on the technical aha moments that you can like, okay, now I kind of can gauge what level we're at if they have or have not been aware of that information, to then those aha moments of, oh, I didn't know Wikipedia, could be edited by anyone at any time. That aha moment, like, oh, I use that all the time, that information, well, my go-to is Facebook all the time, and I really don't go on websites, and I just follow what people are saying on Facebook. So everyone really shares their own personal story and experience. They all have their different aha moments, and that you just kind of have to really gauge that and follow it from what everyone's reactions are to when you're talking about it. And it's really helpful if you have doing this workshop to have helpers on staff to help those that are more behind and using, that have never used technology before, to help them do the searches and help them out with that. I mean, if they're at that level, that's great. We're here to help them. Then if we have someone in the same session that's already been using it, we want to keep it at a pace that everyone's comfortable with. So having those helpers to help them navigate through, and then if you need to stay after to help them understand more technology, technical questions, that's always a good idea.
Yeah, great. Good advice. All right, well, everyone, we are at the top of the hour, so I want to thank you all for attending again. Thank you, Caitlin, so much. This was great. A lot of really good positive comments in the chat as well about your session and the content. I'm sure you'll get some emails too with questions as we wrap things up. But thank you so much. And with that, I will shut this down and let everyone get on with the rest of their day.
Thank you, Derek. Thank you, everyone.
Thanks for watching. This video was produced by the National Network of Libraries of Medicine. Select the circular channel icon to subscribe to our channel. Select a video thumbnail to watch another video from the channel.